I've always wanted to help people and learn more about the human body. That drew me to medicine, and as I started training, I just realized that I was more passionate in helping people get better and comforting them through their journey. As I started with my internal medicine residency, then I grew further interested in pulmonary and critical care. Over those 3 years, I had realized that that is my main passion, to keep trying and to have hope.
Can you say working so closely with complex cancer patients shaped the way you approach pulmonary and critical care?
It does open your eyes to wanting to push the boundaries, to try different things, to help people more rather than stop earlier. I think the biggest thing that I learned is
Welcome back to Mindset with Molly. I have Dr. Muthukumar Radhakrishnan here with me today. He is the only fellowship trained interventional pulmonologist in the River Valley area. He initially started with internal medicine, worked for a little bit, decided to go back and pursue his passion in pulmonary and critical care, and then take it a step further in interventional pulmonology, which is a subspecialty. Okay, let's dive into it. What exactly are you bringing that is a little bit different here to the River Valley?
I'm bringing a wide range of advanced pulmonary procedures that I have trained in during fellowship, which is dependent on the resources available to perform those procedures. Some of the advanced procedures that I bring in would be rigid bronchoscopy, pleuroscopies, pleural biopsies, navigational bronchoscopies, stent placements, endobronchial ultrasound, to name a few.
So, what drew you to medicine in the first place, and how did that evolve into 4 different board certifications?
I've always wanted to help people and learn more about the human body. That drew me to medicine, and as I started training, I just realized that I was more passionate in helping people get better and comforting them through their journey. As I started after my medical school with my internal medicine residency, then I grew further interested in pulmonary and critical care, which then over those 3 years, I had realized that that is my main passion. And following that, I went and practiced for a couple of years as a pulmonary critical care attending, at which point I felt the need to train one more year and subspecialize in interventional pulmonary.
So, you spent time as a hospitalist in the meantime when you completed your residency in internal medicine, and that was at UAMS with multiple myeloma. So, do you want to tell us a little bit about that journey and when exactly you realized, or did you always realize you wanted to do pulmonary and critical care?
I always wanted to do pulmonary and critical care, but I'm grateful for my time in Myeloma Institute. I was there for 4 years, and it opened my eyes up to a whole new world and put medicine in a different perspective of pushing the boundaries, helping people more. It was a great experience, which also helped me learn parts of critical care medicine as well. So I think those 4 years was invaluable in my growth as a physician.
Can you say working so closely with complex cancer patients shaped the way you approach pulmonary and critical care? And I know you just mentioned critical care, but because you deal with a lot of now biopsies and trying to find answers for some of your patients.
I'm sure it did. It does. It does open your eyes to wanting to push the boundaries, to try different things, to help people more rather than kind of stop earlier. So I think that was the biggest thing that I took out of my 4 years there, to keep trying and to have hope.
You completed training working as a pulmonologist and intensivist and then chose to return for fellowship training in interventional pulmonology. What made you want to pursue even deeper specialization?
So during my fellowship in Toledo, University of Toledo is where I did my pulmonary and critical care fellowship, and it was great training, great staff, amazing attendings to learn from. So I'd gathered good skill and practiced as a pulmonologist for a couple of years. When I did feel that I wanted to provide a broader range of diagnostic and interventional procedures in a pulmonary standpoint, along with better yields. And that kind of drove me to wanting to do another year of specialization. So I think that's the big driving part, to get better yields and to offer more services.
I think that kind of goes back to wanting to broaden things for your patients as well, because you're always wanting to do more, have better answers, and be able to offer more services. So I think that kind of falls in line with that. Do you think so?
It does, and it also helps streamlining care for me when I have a patient to take care of, to do the needful things that I can, and then kind of direct care to the appropriate places.
So, how did each stage of your career build on the next? Is there a patient or a moment that played a role in you pushing toward interventional pulmonology, or just as a whole, like you already mentioned?
I would say it's as a whole, because there are a lot of events that change you. Even now, on a daily basis, there is something that changes us, and you have to look back at every event and take the good things that you do and look at things that you need to change, and it needs to be a daily thing for personal and professional growth. I guess just like anything in life, you just have to do that on a daily basis. So I'm sure there are many instances, but it's just that it's probably too many to start listing
We don't
them.
have enough time.
Yeah, probably that is true.
Basically. So, for listeners unfamiliar with what interventional pulmonology is, how would you describe the field in a simple and relatable way?
I would say one has to be a good general pulmonologist before becoming an interventional pulmonologist and focusing on the specialty. So, because if you're not a good general pulmonologist, then it's difficult to be a good interventionalist. So the assumption is that you're taking care of all the general pulmonary needs, but then on top of that, you're able to provide additional diagnostic and therapeutic procedures. So to put it as simple as I can, interventional pulmonary as a field is an interventional pulmonologist is somebody that just is able to do advanced lung procedures.
So, as the only interventional pulmonologist in the River Valley area, what does that mean to patients here, and why is that significant? What does that bring into this community?
It brings in another subspecialist with a unique skill set, and it does help our community, as patients don't have to travel far, and you could start with the first opinion locally, and after that, if you do need to pursue a university center or tertiary center input, we could guide you to those places. And but if we are able to help locally, then that avoids travel. It avoids a lot of unnecessary stress on the patient in an already stressful time in their lives.
So, how has interventional pulmonology changed the way lung disease and lung cancer are diagnosed and treated?
Interventional pulmonology as a subspecialty is growing rapidly, and there are a lot of interventional pulmonologists who are doing great work. It has improved diagnostic accuracy. It has improved diagnosing lung cancers at early stages, with potential treatments and cure depending on the stages that the diagnosis is made. Um, it has helped with improving quality of life in regards to pulmonary disease.
So, in order to diagnose lung cancer, is there a certain platform that you're using currently?
Robotic assisted platforms are really good. There are a few in the market. The one that I use at the present moment is Ion. Did a lot of cases in UAMS with Dr. Nikhil Meena, who was my program director and mentor. And after that, over the last 6 months, we've been doing Ion cases and probably have done about 100 cases as of now. It's a great platform, and I'm very comfortable with the Ion platform. Yes,
Got it.
but you
Okay.
could choose. There are a couple of other platforms too.
Yeah.
But the essence of it is robotic assisted bronchoscopy is a invaluable tool in diagnosing and detecting early lung cancer.
And I think I've heard you kind of describe it as it kind of navigates you, right? You find it on different scans and then you use the platform. Can you kind of go into detail on that when you're
So,
looking for nodules?
so once a nodule or a target or a mass or whatever is identified, and the patient comes to you, then you need to have a way to plan a path, and so you need those images, and there is a software in which you can plan it. I'm just trying to make it as simple as I
Yeah.
can, and it kind of gives you a path to your target, um, and um, and then the bronchoscope is controlled by the robotic arm, and we control the arm, and you drive the scope following the path to the nodular lesion.
Hmm.
Um, the path, it looks like a car navigation to the destination, and then when you're close there, then you have other steps that we employ to biopsy. But again, I think this is kind of a very simple watered down version. It's a little bit more than this,
We're
but
just making it relatable.
yeah.
So, the Ion robot is cutting edge technology, and what makes it so different than traditional bronchoscopy?
There's a lot of things that makes it different, um, but I'll just try to go over simple ones. One is that it can get farther to any location, and traditional bronchoscope, depending on the size of the scope, it may not be able to get to that distance. Two is the operator's hands are kind of available, and the scope is held by the robotic arm, and it's held in position, so it doesn't move that much. So that keeps you more stabilized on the target. Three is the catheter has a shape sensing technology, which also helps. So I think those would be the big things. And the biggest thing would be to be able to navigate the airway tree to get to those distal areas, or to get to areas that you could not reach with the regular scope.
Okay. And we've kind of talked about how you reach the nodules and how that is more safe using the Ion robot because you're planning out this case, like you just mentioned, and everything, and you're getting further into the lungs than you can previously with regular bronchoscopy. So, lung cancer is often diagnosed late. How does the Ion robot change early detection, and why is that so important for survival?
I think the bigger thing is catching them with screening early. A huge component is by the time someone presents, it's already advanced because there's not a lot of symptoms. And if the screening is not there, then it's not picked up. But let's say someone had imaging, and a lesion is found early on the CT. It helps because now you could navigate to that area, biopsy it, and if it is positive, then you can treat it. If it is negative, you can just monitor it. In the past, this used to be just monitored. People would keep watching it, and so then you don't know how that works. Now, with a robotic platform, it becomes easier to biopsy these lesions, and it reduces the time to have the biopsy as well.
Is there anything people should be looking at when screening? I know a lot of times it's kind of put on the physicians um, ahead of time, and in order to see a specialist, you have to have a referral from your primary care. Is there anything you can kind of tell us about screening?
I mean, there is criteria for it, but I would just kind of try to simplify it again. But I would just say anybody who has a significant smoking history, to discuss with their primary to see if they qualify for the lung cancer screening program. And if that's the case, then they would need an annual CT scan. I think a lot of times I would not say to their physicians. It could be the primary physician, it could be the pulmonologist, but just ask somebody, is it do they need to be in the screening program? And if they do, then that would be one way to get. Most of the times, I think we do we do talk to everybody about screening, but for sometimes it just doesn't happen. So if patients are able to ask, like how we have in our mind for colonoscopies and EGDs, it's kind of everybody knows about it and they ask about it, even if the provider doesn't bring it up. The patient generally asks, "Do I need it? Is it my time?" So if somebody has a smoking history, then I would encourage that they ask the question. So then that can be addressed.
Got it. So, what has the patient response been like as you have been offering this technology in the River Valley area?
It's been good. Um, I think we are doing a good job and trying to get patients' answers is what I would say.
Just making people aware, too, that this is a service that is now available and offered to. What do you see as the future of early detection and robotics in your field?
There's a lot in the future in the pipeline. I know there are hospitals that do all of this as a single anesthetic case as well, where they diagnose, if they find it's malignancy, they resect. And there's probably trials going on for therapeutics for smaller lesions with robotic bronchoscopy. So the field is evolving rapidly.
As someone who has worked in the ICU setting, oncology environments, and procedural medicine, what has this career taught you about people?
The career so far has taught me a lot, continues to teach me something every day. Just, I think the biggest thing that I learn is everybody's busy. We're all working, patients, families, physicians, nurses. But we just have to find time um, to just help and support and comfort people. You may not be able to fix everything, but just have to realize that there is so much that you can do to help people, and patients teach you that every day. And when you take care of someone and they improve, that is satisfying.
So, how do you balance the emotional weight of medicine with being a husband and father as well? I don't think I mentioned you were my husband, by the way.
um, well, I guess you can answer that better than.
Having a supportive spouse. No. No, I think that
Yeah.
there's been some really hard days for you over the course of years and everything. And I think that you are extremely compassionate. And I think that you really care for your patients. And I know I'm your wife saying that right now, but I've seen it at work as well, since I used to work in the healthcare field too. So I've seen a lot, and I'm appreciative for what you're able to give your patients as well.
Yeah, I mean, doesn't just need to be healthcare, does it? It's everybody. I mean, anybody who works. I mean, people have jobs, they work. People, work two shifts, they work, you know, and people do things which what they're passionate for, and so no matter what job it is, I think finding that balance of trying to be there for your family and then give your time away. But I think the biggest thing in healthcare is before you get into it, you just have to realize some of that time is not going to be yours. So at least that is what my parents told me when I got into med school. They said, you really sure you want to do this? Because if you do this, then some of the time is not going to be. It's just you have to give it what it needs, the time. And so it is.
It's hard to balance.
It's hard to balance, but I've learned how to balance it somewhat, I guess. But I do know, at least for me personally, when I look at it, because of the balance is always going to be in favor of my patients. So basically, I guess my family loses out on time, which is kind of how it should be, which is what's happening. Because I didn't get into this for lifestyle. So
Yeah. Well, and I will say too, I mean, our kids are aware. They're at an age now, too, that they're aware when you're having to go to work, and they look up to you. They appreciate everything that you do, and we just kind of figure it all out as we're going. Yeah. So, just our takeaways here are early detection, technology, and community impact here in the River Valley area. I know that we're trying our best to get the word out that this is something that's offered here and that you're capable of all of the procedures too. But just making sure that the community understands the impact on the early detection with the Ion robot. Don't you think?
I think so. Not just that, and also that there is that interventional pulmonary is a subspecialty, and it is developing, and just as an advancement in medicine, just pushing that message out because robotic bronchoscopy is an integral part of interventional pulmonary, but not everything the specialty encompasses.
Congratulations on all of your cases and all of your patients that you've helped, especially here in the River Valley in the community. And tune in for part 2.
Well, not sure about part 2. We can see.
No, there'll be a part 2. Thank you so much, Dr. Rad.